In this video, we'll discuss about lung abscess. What is lung abscess? It is a necrosis of pulmonary tissue and formation of cavities. Formation of cavities containing necrotic debris, pus and fluid in multiple areas of the lungs. Short form, it is localized area of necrosis with suppuration, that is pus formation. This cavity more than 2 centimeter. Causes of lung abscess. It is due to aspiration, periodontal disease, that is tooth and gum infection, then seizures disorders or alcoholism, drugs like general anesthesia and central nervous disorder. So there are the two type of lung abscess. These are the things considered as primary lung abscess. Primary lung abscess due to aspiration, periodontal disease, that is tooth and gum infection, seizure disorder, alcoholism, drugs like generalized anesthesia and central nervous disorder. This primary lung abscess that develop in normal lungs. Secondary lung abscess because of pneumonia, malignant tumor of that respiratory tract. It can be due to any bacterial causes. So secondary lung abscess because of pneumonia, then malignant tumor of the respiratory tract. This one caused by bacteria. Example, Staphylococcus aureus, Klebsiella pneumoniae, Nocardia species, microphilic streptococci, staphylococci and gram-negative bacilli. So what are the bacterium? Staphylococcus aureus, Klebsiella pneumoniae, Nocardia species, microphilic streptococci, staphylococci, bacteroides and gram-negative bacilli. So primary lung abscess that develop in normal lungs, and the secondary lung abscess is because of complication of some other diseases. That disease will come to lungs, that infection will come to the lungs and affect, that is secondary lung abscess. Then etiopathogenesis, infected foreign materials, then bacterial infection like tuberculosis and pneumonia, then bronchial obstruction, then septic embolism, some miscellaneous because of pulmonary infarct, endemoeba histolytica and trauma. Primary lung abscess, it affect the lungs directly, that is primary lung abscess. Secondary lung abscess, where is a disease elsewhere in that body, will come and affect the lungs. Then this etiopathogenesis, aspiration of infected foreign material which is having some bacteria or something that infect things is going to get aspirated into the lungs. Would be some organic matter, it would be some food, it would be some gastric content that may get aspirated to the lungs. So all these can causes lung abscess, some infection in lungs. Then pathophysiology, due to aspiration of microorganism found in oropharynx, adherence of that bacterium to the lung wall, then releasing inflammatory mediator and macrophages, inflammation and initiation of the lungs parenchyma. So first one is due to aspiration of microorganism, that one found in oropharynx. Then this bacterium adhere to that lungs wall, then it will releasing inflammatory mediator and macrophages. After that it will causes inflammation and initiation of that lung parenchyma. This condition name is called as pneumonitis. inflammation and initiation of the lungs parenchyma, pneumonitis. Then formation of liquefactive necrosis, that is inside lungs form liquid, then development of lesion with necrotic debris called cavities or abscess. Then deposition of that fibrous scar tissue around the abscess, it form necrosis of lungs. So this is all about pathophysiology. Pneumonitis, then formation of liquefactive necrosis, then development of lesion in necrotic debris called cavities or abscess, then deposition of fibrous scar tissue around abscess, it is called necrosis of lungs. Next, clinical manifestation: purulent bowel smelling sputum, then hemoptysis, blood with sputum, then halitosis, that means bad smell in that mouth, then chest pain, dyspnea, breathing disorder, cough, then anorexia, weight loss, fever, chills, shivering, sweating, then we heard sound during lungs and this one heart during stethoscope time, heard extra sound, that respiratory crackles, then dullness on percussions. So these are the clinical manifestation: purulent bowel smelling, hematotytis, halitosis, purulent pruritic, chest pain, dyspnea, cough, anorexia, weight loss, fever, chills, sweating, and respiratory crackles. Cross and microscopy, basically we'll see that 5 to 6 centimeter and diameter. So basically it will be few millimeter to large cavities. These cavity containing exudates, then it is surrounded by acute pneumonia. It has poorly defined ragged wall. So it have poorly defined ragged wall. They are saying with passage in time the abscess can become chronic and develop into fibrous wall. Then histological under microscope we can estimate by using X-ray, chest X-ray, cavities cavities filled with fluid we can estimate. If not seeing properly, we can using CD scan or UGC. Then we can using culturing that sputum or tracheal aspirate. By using culturing we can identify microorganism. Then deep inside that lungs we can use that bronchial was and aspirate. By using bronchoscope we can identify. Suppose if that organism in deep inside the lungs, means bronchial wash, by using bronchoscope we can isolate that microorganism. So this is all about lung abscess.